As we age, or as we occasionally experience injury, it may not always be as easy to get out of the house and to the doctor's office. The great news is that some area primary care providers offer home visit services to qualifying patients to give them convenient, quality health care right at home. Joining me now to talk about home visits and how they can benefit patients is Baptist Medical Group board-certified nurse practitioner Pat Hill, who provides home visits to established patients. Pat, thanks for being here.
Thanks for having me.
Well, this is a very interesting concept that I wasn't that familiar with, but first of all, tell me a little bit about you. I believe you're over in Pace, and what led you to be where you are today?
My husband's career brought us to the area. He retired from the Navy, and we were fortunate enough to be able to settle in Santa Rosa County. It's beautiful, and have the opportunity to work at a great primary care providing office.
Well, great. Well, we were talking before we went on air about transportation and that portion of the whole equation of home visits. How rare are home visits? Is this something that is catching on, or is there just a greater need for it?
I think there's a greater need. The ability of patients to get to the office depends on not just money, transportation, family, but oftentimes there's a physical or a mental disability that makes it difficult for them to get to the office. So we wanted to take an opportunity to help our patients that had a hard time getting to us by bringing care to them.
Okay. And what's their feedback? Are they familiar with this concept?
They love it. They love it. Primary care is a special type of medicine. You get to see patients from birth to the end of life, and most of our patients that we see in a home visit have a physical disability or they're aged. And it's very nice to be able to go into the home setting, see what their life is like, understand what their limits are, and to be able to provide care for them.
Well, and you get to see their real environment and what may be contributing to some issues that they may have.
It really helps to be able to establish a plan of care when you've been in that environment with them.
Yeah, it's great information to have. So what is involved in a typical home visit?
It's very much like an office visit. You know, you obtain the same type of information, vital signs, a good history, a review of their medications and their other providers that see them, what's going on with those services. And then you just make an assessment and develop a treatment plan. Oftentimes we can continue to accommodate patients in the home setting. Sometimes we have to order some testing that are done outside, and then certainly there are appropriate times to have the patient follow up with a physician in the office.
So there are times when they will make an office visit?
Absolutely. Certainly sometimes decision making can be complex, and it's important to bring the physician in on those decisions.
Do you find that some of those conversations may involve spouses or caregivers, family members?
Absolutely. Most of the time what brings us to the patient in the home is the concern of family members or the caregivers. And oftentimes we're meeting the needs of those individuals as much as the needs of the patients, because it's difficult.
Sure, we consider families of our seniors to be our clients and customers as well.
Absolutely.
It is the big picture. Well, are there some patients that maybe this is a better option for than others?
Certainly, in terms of establishing the appropriateness of a home visit, you're looking at either a financial hardship or a physical hardship that makes it difficult for the patient to come into the office. So some of our patients have disabilities. Oftentimes it's dementia or the lack of resources to get the patient to the office.
Are there some medical conditions that are more appropriately treated in the office rather than a home visit? Or
Certainly.
How does that part work into
Certainly. We are limited. I'm not able to do any procedures in the home. That would not be appropriate. And the complexity of the situation, what's going on with the patient, determines whether or not their needs can be met in the home or the office.
Mm-hmm. Well, I'm sure there's a relationship that's developed too between you and the patients as well.
Certainly. Oftentimes I feel like a member of the family. It's very nice. It's very rewarding.
Well, what are some common myths that may exist about home visits? Because like I said, I don't know that a lot of people are really even familiar that this is even an option.
Right. I think there are several. I think the first thing that you have to establish is that this is a provider visit. There are a lot of resources in the community that come into the home. You have home health nursing, you have physical therapy, occupational therapy, social workers, and in some cases hospice. So getting the patient to understand that this is actually a provider coming to the home that's going to assess the situation and develop a treatment plan and take care of you much like the physician would in the office. Another myth, I think, is they think it's going to cost them more, or that it's some type of boutique type medicine, and it's not. And family medicine, our purpose is to serve their primary care needs and do a lot of prevention and teaching, and the home is a great place for that.
It's great that you pointed that out. And speaking about costs, what about insurance? Does insurance cover home visits like it would an in-office visit?
It does. We have an amazing group of talented co-workers with me that verify that information prior to me going out into the home. There are certain things or requirements that have to be met in order to get reimbursement from insurance company, but we take care of that on the front end and don't have the patient worry about that.
Okay. And do you find that they're more comfortable? Do you find that people share information possibly more freely in a comfortable environment
Absolutely.
versus just the anxiety of going to a doctor's office?
Absolutely, because you're on their home turf. So there's nothing more relaxing than being at home, and they've been very welcoming.
Great. Well, if one of our viewers thinks this might be a great option for them or for someone they know, what would you say to them or suggest they do next?
The first thing is you have to be an established patient within our practice. So initially it would require a visit into the office. That way we can make a determination about the appropriateness of me being in the home setting with the patient and to see what the patient's needs are. So it would just be a phone call to Baptist Medical Group in Pace and initiating an appointment in the office.
Great. Well, it's wonderful information, and it's nice to know that that is an option here, because it sounds like a very good one for many people.
Thank you.
Thank you.